Experts have suggested that better sanitation infrastructure and access to clean water could have significantly mitigated the impact of the outbreak of cholera. Here's the report.
Cholera, a diarrheal disease caused by bacterium Vibrio cholerae, poses significant risk as it spread through contaminated water, food, and person-to-person contact. Poor hygiene exacerbates its transmission, particularly affecting areas near rivers where sanitation practices are inadequate. These health practitioners stress the critical importance of access to clean water at the community level to mitigate the impact of this outbreak.
Generally, cholera is a diarrheal disease, and the culprit involved is Vibrio cholerae. Most likely spread to water, spread to food, person to person, hand to mouth. The major, or the most possible cause or possible way by which this is spread is through poor hygiene. I will note that generally the places affected are places close to all this riverside area, and that is because it is easily transmitted through water. So besides seeing the cases, we were worried, we were concerned. At the time, we were asking them their source of water for cooking, for use at home, where they get their food from. But these are the possible ways in which individuals could contract the disease condition.
Residents of Lagos are urging the government to take proactive measures to curtail the spread of the disease.
The place I'm coming from, or the place I'm residing, there's no good water there. You know, every building has their own, they provide water for themselves, okay? They drill boreholes, okay? They drill boreholes. And those, some have tanks up there, okay? The whatever, what's it called? They will pump water from that borehole up to that tank. And that tank, those water there are not treated, okay? So there might be some bacteria that will store in that water. And it's very, very detrimental to human health.
Cholera disease that is ongoing in the country. The government should at least, our health care centers in Nigeria should be able to find a source to disseminate information to the masses. One, and also the masses on their own should also try to keep a good hygiene, a more good hygiene, and wash your hands thoroughly, eat proper food, do the proper things you ought to do to avoid this health issue. But in terms of the government have also some duties to perform here by going to the health centers or other health organizations to provide necessary medications to fight against this illness, you understand, and also to enlighten people about it.
Residents are calling on the government to provide essential medications to health centers and educate the public about preventive measures against the illness.